Do you feel stressed out, tired, or anxious? If so, you might be experiencing the effects of cortisol, also known as the stress hormone. You may have heard of cortisol before, but do you really know what it does in your body and how it affects your health? In this video, we'll explore everything you need to know about cortisol, from its function in the body's stress response to how it impacts your physical and mental health. We'll also give you some tips and tricks for keeping your cortisol levels in check, so sit back and get ready to see how you can lower your cortisol levels. Cortisol is a hormone made by a small gland called the adrenal gland, which sits on top of each kidney. When the body senses danger or stress, a signal is sent from the brain to the adrenal gland to make and release cortisol. This signal is sent through two other glands in the brain called the hypothalamus and pituitary gland. Cortisol plays an important role in regulating your mood. In the short term, cortisol can help you feel more alert and focused, allowing you to better handle stressful situations. However, when cortisol levels remain elevated for an extended period of time, it can have negative effects on your mood and emotional well-being. Studies have found that chronically high cortisol levels are associated with an increased risk of anxiety and depression. This is because cortisol can interfere with the production of other hormones that help regulate mood, such as serotonin and dopamine. High cortisol levels can also lead to fatigue, irritability, and difficulty concentrating. It can also affect the way you perceive and respond to stress. Research has shown that high cortisol levels can make you more reactive to stressful situations, increasing the likelihood of negative emotional reactions. Overall, cortisol can have both positive and negative effects on your mood, depending on the duration and level of exposure. The hormone also plays a key role in regulating metabolism. Cortisol works to increase blood sugar levels by stimulating the liver to release glucose into the bloodstream. This is a natural response to stress or other perceived threats, as the body needs more energy to respond to the situation. Cortisol also plays a role in the breakdown of fats and proteins for energy, which can lead to weight loss in the short term. However, when cortisol levels are consistently high, the body can become resistant to insulin, a hormone that helps regulate blood sugar levels. Insulin resistance can lead to elevated blood sugar levels and increased storage of fat, particularly around the abdominal area. This can make it difficult to lose weight, even with exercise and a healthy diet. It can affect your appetite and food choices. Some people may experience increased cravings for high-calorie foods when stressed, leading to weight gain and metabolic dysfunction. On the other hand, others may experience a decrease in appetite and unintentional weight loss. When experiencing high levels of cortisol for a long period, it can give you severe health risks such as 1. Cardiovascular health. High cortisol levels can increase blood pressure, heart rate, and the risk of heart disease. Cortisol can cause the blood vessels to constrict, which can increase blood pressure and lead to long-term cardiovascular problems. 2. Immune function. As mentioned earlier, cortisol can suppress the immune system, making the body more vulnerable to infections and diseases. 3. Weight management. Cortisol can impact weight management in various ways. In the short term, cortisol can lead to weight loss by breaking down fats and proteins for energy. However, prolonged high cortisol levels can lead to insulin resistance, which can cause weight gain and make it harder to lose weight. 4. Bone health. High cortisol levels can cause bone loss and decrease bone density, leading to an increased risk of osteoporosis and fractures. 5. Digestive system. Cortisol can affect the digestive system by increasing stomach acid production and slowing down digestion, which can lead to issues such as acid reflux, ulcers, and irritable bowel syndrome. 6. Mental health. Chronic high cortisol levels can also have negative impacts on mental health, leading to anxiety, depression, cognitive impairment, sleep disorders, and can lead to substance abuse or other addictive behaviors. It is important to control the levels of cortisol. By controlling cortisol levels, we can reduce the negative effects of chronic stress and promote better overall health and well-being. This can be done through a combination of stress management techniques, lifestyle changes, and in some cases, medication or supplements. Here is a list of tips and tricks that might help you lowering stress. 1. Practice stress management techniques. Engage in activities that reduce stress, such as meditation, yoga, or deep breathing exercises. These techniques can help lower cortisol levels and reduce the impact of stress on the body. 2. Exercise regularly. Regular exercise can help regulate cortisol levels, reduce stress, and improve overall health. Aim for at least 30 minutes of moderate exercise, such as brisk walking or cycling most days of the week. 3. Get enough sleep. Adequate sleep is essential for regulating cortisol levels. Aim for 7-8 hours of sleep per night and try to maintain a consistent sleep schedule. 4. Maintain a healthy diet. A diet rich in whole, nutrient-dense foods can help regulate cortisol levels and reduce the impact of stress on the body. Avoid processed foods, sugary drinks, and excessive caffeine, which can increase cortisol levels. 5. Social support. Having strong social connections can help reduce stress and lower cortisol levels. Spend time with friends and family and engage in activities that bring you joy and relaxation. 6. Consider therapy. Cognitive behavioral therapy, CBT, has been shown to be effective in reducing stress and cortisol levels. Consider speaking with a therapist or mental health professional to learn stress management techniques and develop coping strategies. By incorporating these tips into your daily routine, you can help regulate cortisol levels and reduce the impact of stress on your body and mind. There are also several supplements that have been shown to help reduce stress and lower cortisol levels. Here are some examples. 1. Ashwagandha. Ashwagandha is an adaptogenic herb that has been used for centuries in traditional Ayurvedic medicine to promote relaxation and reduce stress. Studies have shown that ashwagandha can lower cortisol levels and reduce symptoms of stress and anxiety. 2. Rhodiola rosea. Rhodiola is another adaptogenic herb that has been shown to help reduce stress and improve mood. It works by regulating the stress response system and lowering cortisol levels. 3. Magnesium. Magnesium is an essential mineral that plays a role in many bodily functions, including the regulation of stress and anxiety. Studies have shown that magnesium supplementation can help lower cortisol levels and reduce symptoms of stress and anxiety. 4. Omega-3 fatty acids. Omega-3 fatty acids found in fatty fish and fish oil supplements have been shown to help reduce inflammation and lower cortisol levels. 5. Vitamin B complex. B vitamins are essential for energy metabolism and nervous system function. Studies have shown that B complex supplements can help lower cortisol levels and improve mood. It's important to note that while these supplements may be helpful in reducing stress and cortisol levels, they should not be used as a replacement for other stress management techniques such as exercise, relaxation, and social support. Consult with your healthcare provider before starting any new supplements. And with that being said, we have come to an end of our video. Thanks for tuning in to learn more about cortisol. We hope this video has helped you understand the role cortisol plays in the body and how it can impact your physical and mental health. Remember, while cortisol is a natural and necessary hormone, high levels of cortisol over an extended period of time can have negative effects on the body. By practicing stress management techniques, making lifestyle changes, and seeking support when needed, you can help control cortisol levels and promote better overall health and well-being. In the next video, we will talk more about the different types of magnesium and how it can be of use for you. And don't forget to hit that subscribe button so you don't miss out on any of our informative and animated videos. And if you found this video helpful, please give it a thumbs up. Thank you for watching, and we can't wait to share more with you in the future.